My name is Bruce Stevenson. I am part of today's dental consulting, and what I'd like to show you in this video are some suggestions for New Year's resolutions that hopefully will be beneficial for your practice. The first thing to know about today's dental consulting is that we only work with offices that are using Open Dental software or switching to Open Dental software. However, we do not receive any money from Open Dental, and we're not affiliated with Open Dental except as a user. We pay them monthly support the same way that you do. So my objective is to give you some suggestions to hopefully make your office more profitable, easier to operate, and also to improve your patient care. We've created a web page on our website that has other resources pertaining to this video. So if you go to our website, todaysdentalconsulting.com, and then click on that 2023 on the navigation bar on the upper right. Our first suggestion for the new year is to upgrade Open Dental and learn a little bit more about how Open Dental operates and how it can benefit your office. Now, in all fairness, I have to tell you we're biased because our business is showing offices how to use Open Dental more effectively. You don't really need us to do this on your own. There's lots of resources, but we can make it a whole lot easier. So it's easier to find out which version you're on. I've got a little cheat sheet here, which is also on the website that I mentioned. And if you're running an older version like this, it's a couple years old, not only are you missing out on a lot of really good new features, but you also may not have the ADA codes in there for last year or this year. Unfortunately, we're at war with insurance companies, and we need everybody on our side that we can get, including Open Dental. If you're not using the current features in Open Dental, you're kind of shooting yourself in the foot, or worse, and you're also losing money. So the next thing you do after you've done your upgrade to the current version is start looking at your KPIs or your graphs, and Open Dental makes this really easy. And I think you want to share this with the staff. I think it's important that everybody looks at these at least once a month. Back in the 1920s, psychologists came up with what they call the Hawthorne effect. And basically what it says is when you measure something, it tends to get better. And this is why you want to share the information with your staff, so everybody is looking at those graphs. The graphs are pretty easy to set up, and I've got a little cheat sheet on our web page. Remember, once you get this set up, Open Dental is going to automatically run these graphs for you the first of each month. So let's kind of take a look at some of the things that we look at. Single most important metric to look at is on the upper right. It's the income. And you can see here this practice has a modest increase, but at least it's an increase. The trend is important. We want to see how things are trending over the last year, and that's what the graphs are very good for. It's also important to look at your accounts receivable. And again, you can see this is trending down. That's a good thing. We also want to look at the ratio between the accounts receivable and your net production. We want the accounts receivable to be below 1 month's net production. Okay, now that we've upgraded to the current version and we started looking at our graphs, it's time for suggestion number 3, which is to give patient choices. The problem in the past is a lot of software made it very difficult to present treatment options. Open Dental is not like that. This doesn't mean you have to present 15 different treatment plans to every patient, but when there are reasonable alternatives, Open Dental makes it very easy to line these up and present them to the patient. This will dramatically increase your case acceptance. Let me show you how easy it is to complete alternative treatment plans. So I just selected the teeth, and I did a bridge. Now I can change my mind. I want to do a different kind of bridge there. I can edit my plan here, go back and put a PFM bridge. As simple as that and as fast as that. Now I'm going to show you the magic button right there, the treatment plan button. We'll name this treatment plan so we don't get confused. And this is going to allow us to enter alternative treatment plans. So we'll do one for a partial here. You can see it's blank. Okay, go in, pick the teeth, go down to the removable, click on cast. There's my cast partial treatment plan. Now let's go in and do another one. Let's do one for implants. Okay, I'm going to name it here again so we don't get confused. There we got it. We're going to pick my teeth, go in and pick the implant abutments, pick the conics, and then we'll do a freestanding implant and crown over there. Just a few clicks and I'm all done. Back over in the treatment plan module, I can show him each one of those options and the costs associated with each option. Once it's set up correctly, it's very easy to present alternative treatment plans to patients, let the patients choose, and go ahead with the treatment that they want to have done. If you found this video useful, click on the subscribe and the thumbs up button, and also the little bell icon so you get notified about future videos. If you'd like some help in using Open Dental to make your office more profitable, make your practice easier to run, and to improve your patient care, give us a call. That's what we do. You can also schedule a free consultation with us just by going to our website, todaysdentalconsulting.com, and clicking on that yellow scheduling link at the top of the page. Today's Dental Consulting would like to wish you and your staff and your office a happy and very prosperous new year.